Hello, I'm Dr. David Carpenter, Medical Director of Acute Stroke Services at Barnes-Jewish Hospital. This training video was developed to help you, our nursing staff, properly screen patients for swallowing problems after a stroke. Swallowing problems, or dysphagia, occur in nearly 40% of all patients who have had a stroke. When a patient has dysphagia, they're more likely to become malnourished, develop pneumonia, or die from complications. As part of our commitment to provide exceptional care to our patients, we are a Joint Commission certified Stroke Center of Excellence. It's our responsibility as a Stroke Center of Excellence to screen all stroke patients for dysphagia prior to any oral intake. Please pay close attention to the evaluation process and follow each direction accordingly. If you have any questions regarding the screening process, please don't hesitate to ask. Thank you, and let's begin.
The dysphagia screen was developed and validated at Barnes-Jewish Hospital. It was designed to be quickly administered and was developed using components of a standard neurological assessment conducted by nursing. There are 5 components to the screening process: Glasgow Coma Scale, facial symmetry, lingual symmetry, palatal symmetry, and the 3-ounce water challenge. The first component of the dysphagia screen is the Glasgow Coma Scale. This scale is used to establish a patient's level of consciousness. The scale has 3 components which result in a score, from 3 to 15. The first part of the Glasgow Coma Scale is assessing eye-opening response. If the patient's eyes are open and they are alert, the patient receives 4 points. If the patient's eyes are closed, but they open spontaneously on verbal command with blinking at baseline, the patient receives 3 points.
How are you?
If a painful stimulus is used to evoke an eye-opening response,
Mr. Clark.
the patient receives 2 points. If the patient's eyes are closed and don't open to any of the above, the patient receives 1 point.
Mr. Clark.
The second category is the verbal response. Verbal response is used to measure alertness and orientation. Test verbal response by asking the patient his or her name,
Can you tell me your name?
David Clark.
Okay, good.
Where they
you
are.
right now, Mr. Clark?
We're at Barnes Hospital.
the
Can you
date,
tell me the
month,
month?
and year only,
It's September
How about the year?
2009.
and who the current president is.
It's President Obama.
If the patient answers all the questions correctly, give the patient 5 points. If the patient seems confused
Can you tell me your name?
Dave
but is able to answer the
And
questions
what's your last
correctly,
name?
Clark.
the patient receives 4 points. If the patient uses an inappropriate or wrong response,
And where are you right now, Mr. Clark?
Home.
but uses discernible words,
Can you tell me the month?
Saturday.
How about the year?
1984.
3 points are given. If the patient's response is incomprehensible,
Can you tell me your name?
they receive 2 points. If the patient gives no response at all,
Can you tell me your name?
1 point. The last category of the Glasgow Coma Scale is motor response. This category is used to determine movement. Ask the patient to raise and extend his or her arms in front of his or her body. 6 points are given if the command is obeyed. If the patient localizes to noxious
Can you
stimuli,
feel this? Can you tell which finger I'm touching?
Right little finger,
Okay. And on this hand?
left little finger.
5 points.
Mr. Clark?
If the patient withdraws from noxious stimuli,
Can you tell which finger I'm holding? Okay, and how about this?
4 points. If the patient exhibits abnormal flexion, meaning decorticate posturing, 3 points. If the patient exhibits extensor response, meaning decerebrate posture, 2 points. If there is no movement at all, 1 point. Now, the Glasgow Coma Scale evaluation is complete. Add up the points. If the score is 13 points or less, the patient has failed the screen. Note, once a patient has failed any part of the dysphagia screen, they fail the screen, and the screening process should be discontinued. With a score of 13 points or above, continue with the next component, facial symmetry. Facial symmetry is used to discover any abnormality with the mouth. Ask the patient to smile.
Now, Mr. Clark, can you smile for me?
The smile should be
Show me your
wide,
teeth.
showing the teeth. This component will expose any weaknesses
that's good.
around the mouth. If the patient shows any droopiness and/or weaknesses in his or her smile, the patient has failed this component.
Fine. Are you
Discontinue the screening process.
good?
If the patient passes the facial symmetry portion, the next screening component is lingual or tongue symmetry. This will determine any abnormality with the tongue. Ask the patient to stick out his or her tongue.
All the way out.
Pay attention to its position. The tongue should extend straight forward with no deviations to either side. If the tongue deviates, showing difficulties or weaknesses with extension, the patient has failed this component. Discontinue the screening process. If the patient passes the lingual component, the next component is palatal symmetry. This component is used to observe the elevation of the soft palate.
Open your
With the
mouth.
mouth open, use a tongue depressor and light, and observe movement of the soft palate by having the patient say ah 3 to 4 times in a row. The palatal elevation should be symmetrical. If any weakness or unilateral deviation with the soft palate is noted, the patient has failed this component. Discontinue the screening process. If the soft palate is functioning normally, move to the final component of the screening process, the 3-ounce water challenge. Sit the patient up straight and give them a cup containing 3 ounces of water, no straw. Have him or her drink the water nonstop until it is gone. If the patient demonstrates coughing, choking, throat clearing, or wet vocal quality, the patient has failed this component. In order to pass the screen, the patient must pass every component. If the screen is passed, then start the patient on a regular diet. If a patient fails any component of the screening process, the patient should be kept NPO until an evaluation by a speech pathologist is completed. Patients can become very upset when told they failed the screening process. To minimize their anxieties, it's important that you provide a clear explanation of how they failed and the severity of dysphagia. Here are a few examples. You could say,
It looks like your face is a little weak on the right side. This is concerning as it puts you at risk for having food or liquids go into your lungs when you eat or drink. If this happens, it could result in a pneumonia. We want to make sure you're safe, so we'll have our speech pathologist take a closer look at your swallow function before you eat or drink. Unfortunately, it is 2 a.m, and speech therapy is not here currently. They arrive around 7:30, and we'll page them to make sure you are seen as soon as possible.
or
Your mother is not quite as alert as we would like her to be for eating. This may result in having food or liquids go into her lungs when she is eating, which can cause complications. She needs to be seen for a full evaluation by a speech pathologist before she is able to eat or drink. I will page them so they can come and evaluate your mother's swallow function.
or
You demonstrated a little cough after you drank that water. That concerns us as it may indicate you have a risk for food and liquids going into your lungs when you eat or drink. If this is happening, you could develop pneumonia and other complications. We would like to have our speech pathologist evaluate your swallow more completely to make sure your swallow function is adequate before you can eat or drink.
keep in mind your patient may be confused or disoriented, so be patient. It may be helpful to include a relative of the patient for support. Just remember to show as much compassion and sympathy as possible.